Have you ever stopped to think about the really detailed stories unfolding inside an animal's body? I mean, not just what you can see, but the invisible stuff, the chemical signals flowing in their blood that tell us so much about their health. Well, today, that's exactly what we're diving deep into. The fascinating world of equine plasma proteins. And these aren't just, obscure scientific terms. They're vital clues, real dynamic indicators of a horse's well-being.
Yeah, they're like the unsung heroes, constantly communicating.
Exactly. Everything from a subtle internal whisper to a full-blown emergency signal.
So our mission, really, on this deep dive is to unpack what these proteins actually are, what essential jobs they do throughout the horse's system, and maybe most importantly, what changes in their levels can tell us diagnostically. We want to show how these tiny molecular shifts can signal, well, everything from quiet inflammation right up to really life-threatening conditions.
And for you listening, the goal is to get a really comprehensive understanding, but without, getting bogged down in jargon. We hope you'll find some surprising facts here. Okay, let's dig into this. So, starting right at the basics, what exactly is plasma? People think blood, obviously, but plasma is that specific fluid part, right, where all these proteins live.
Exactly, it's the liquid matrix. And the roles these plasma proteins play are, well, astonishingly crucial. They're maintaining fluid balance, they contribute massively to immunity, they help with blood clotting, and they transport all sorts of substances around. And what's really key here is how even slight changes in their levels are significant indicators, often immediate signs of underlying disease. It's like the horse's internal alarm system going off.
Okay, so given how vital they are, who are the main players?
Oh, yeah.
The sort of headliners in this story? Our sources really point to two big categories, albumin and globulins. And then there's fibrinogen, which seems critical and is often measured separately.
That's right. Those are the big three we tend to focus on. And where do they come from? Well, the vast majority are synthesized in the liver by liver cells called hepatocytes. But there's a key exception, immunoglobulins. They're a type of globulin, but they're actually produced by specialized immune cells called plasma cells, part of that targeted response.
Interesting. Okay, let's kick things off with the albumin then. This one's the heavyweight, right? The most abundant plasma protein. That alone tells you it must be doing something fundamental.
It certainly does. Its number one job is maintaining what we call oncotic pressure, or colloid osmotic pressure. Basically, it's albumin's role in keeping fluid inside the blood vessels, preventing it from just leaking out into the tissues.
Ah, okay. So without enough albumin, fluid seeps out, and that's where you see swelling or edema.
Precisely. You could think of albumin almost like a magnet. It holds the water firmly inside the blood vessels.
That water magnet idea really helps visualize it.
Yeah.
But it does more than just hold fluid, right? I understand it also has a crucial transport role. What else is it carrying?
Oh, absolutely. It's a major transporter. It binds to and carries loads of vital substances that wouldn't dissolve well in blood on their own. Things like hormones, thyroid hormones, cortisol fatty acids, bilirubin, even many drugs we give horses. Albumin makes sure they get delivered where they need to go.
And I think our sources mentioned a minor role as a protein nutritional reserve too. But really, it's that fluid balance and transport that are key.
Those are definitely the main functions, yes.
Okay, so let's shift gears to globulins. This group sounds more diverse. The sources call them heterogeneous, and they're categorized alpha, beta, gamma, based on how they move in an electric field.
That's right. It's a lab technique, electrophoresis, that separates them. And within those alpha and beta categories, you find some really critical players. Many of them are what we call acute phase proteins, things like haptoglobin, transferrin, ceruloplasmin. What's fascinating is that these proteins are like the body's first responders. Their levels shoot up really quickly, within hours to days, in response to inflammation, infection, trauma, even significant stress.
So they're like an early warning system.
Exactly. And they also play transport roles themselves, carrying lipids, hormones, vitamins, minerals, like transferrin specifically transports iron. And many of the clotting factors we need are actually beta globulins, so they're doing a lot in those alpha and beta groups.
Okay, a lot happening there. But then we get to the gamma globulins. These are the immunoglobulins, right? The antibodies like IgG, IgM, IgA, IgE that we hear about with immunity.
Yes, and this is where their vital role in immunity really comes into play. These are the antibodies. They're produced by those specialized plasma cells, which are activated B lymphocytes. Their job is to recognize and neutralize specific pathogens, bacteria, viruses. They provide that crucial humoral immunity, the antibody-based defense.
And speaking of immunity, this brings us to a really critical clinical issue, failure of passive transfer, or FPT, in newborn foals. Why are these gamma globulins so essential right at the start?
Ugh. FPT. Yes, this is absolutely critical. Foals are born with a naive immune system. They rely entirely on absorbing maternal antibodies, mostly IgG, from the mare's first milk, the colostrum, within the first, say, 12 to 24 hours. That IgG provides their initial protection. If a foal doesn't drink enough colostrum or doesn't absorb it properly,
They don't get that protection.
exactly, they end up with dangerously low gamma globulin levels, that's FPT. And it leaves them incredibly vulnerable to common infections, which can quickly become overwhelming and sadly fatal. Measuring those gamma globulins, often IgG specifically, is key to diagnosing FPT.
Wow, okay. So that highlights just how critical they are, especially early on. Now, next up, fibrinogen. Our sources put this as a beta-globulin, but also call it a crucial acute phase protein and central to the coagulation cascade. Sounds like it wears multiple hats.
It absolutely does. Fibrinogen really performs two major functions, both incredibly important. First, its direct role in clot formation. When there's an injury, fibrinogen is rapidly converted into insoluble fibrin strands. These strands form the meshwork, the sort of scaffold of a blood clot, essential for stopping bleeding.
Okay, the clotting part makes sense. But the inflammation marker role, how did that work?
Well, its concentration in the blood significantly increases, and quite dramatically, within just 24 to 48 hours of any inflammatory stimulus. Doesn't matter if it's infection or trauma or surgical stress. This rapid and marked increase makes it a really valuable and very sensitive indicator of systemic inflammation in horses, much more so than, say, just looking at white blood cell counts sometimes.
So a vet could use it to track progress, like
Right.
if the fibrinogen level is coming down after treatment.
Exactly. It's very useful for monitoring response to therapy. If you're treating an infection, seeing that fibrinogen level decrease is a good sign that inflammation is resolving.
Right. So we've covered what they are and their normal jobs. Now let's get into the diagnostic power. What happens when things go wrong? How do abnormal levels point to problems? We're talking increases, hyper or decreases, hypo in total protein, albumin, or globulins.
Exactly. And interpreting these changes is key. Let's start with total protein abnormalities. If you see hyperproteinemia, that's high total protein, the most common cause, honestly, is just dehydration.
Simple dehydration.
Yeah, hemoconcentration. The horse loses fluid, the proteins get more concentrated, like reducing a sauce, basically. It can also be caused by very high globulins, hyperglobulinemia, which you might see with chronic inflammation or certain cancers like lymphoma. Clinically, you might see signs of dehydration like tacky gums or sunken eyes.
Okay, and the opposite, low total protein, hypoproteinemia.
That can happen for several reasons. Acute, severe blood loss is when you lose everything, including proteins. But probably the most common scenario we see in horses is protein-losing enteropathy, or PLE.
PLE, that's protein leaking from the gut.
Exactly. Diseases like inflammatory bowel disease, severe parasitism, certain infections can damage the gut lining, causing protein to leak out into the intestines and be lost. Other causes include protein-losing nephropathy, PLN, where protein's lost through the kidneys, though that's rarer in horses. Severe liver disease, but the liver has huge reserves, so you need like over 80% functional loss.
Wow.
Yeah. Severe skin loss, like from major burns, or just chronic severe malnutrition can also lower total protein.
And what's the big sign vets look for?
The hallmark sign, especially if albumin drops below about 2.0 grams per deciliter, is peripheral edema. That swelling in the legs, under the belly. It's because there isn't enough protein, mainly albumin, to hold fluid in the vessels.
That makes sense linking back to albumin's job. So for albumin abnormalities specifically, hypoalbuminemia, low albumin, shares many causes with low total protein, right? And since albumin is the main component being lost or not produced.
Precisely. PLE, PLN, liver failure, malnutrition, they all hit albumin hard. And that resulting edema is the classic consequence.
And high albumin,
Yeah.
hyperalbuminemia.
That's almost exclusively due to dehydration, hemoconcentration again. It's a really strong indicator the horse needs fluids.
Okay. Moving on to globulin abnormalities.
Right.
What about high globulins, hyperglobulinemia?
The most common reason for that is chronic inflammation or infection. The body is constantly stimulated to produce more antibodies, which are gamma globulins, and more acute phase proteins, which are alpha and beta globulins. So the total globulin level rises. Less commonly, certain cancers, particularly multiple myeloma, can cause a massive increase in just one specific type of antibody. That's called a monoclonal gammopathy, and it produces a very distinct pattern on further tests.
And low globulins, hypoglobulinemia.
This is most critical, as we discussed, in foals due to failure of passive transfer, that lack of maternal antibodies. In older horses, it's much rarer, but could indicate primary immunodeficiency syndromes like SCID in Arabian foals or perhaps severe generalized immunosuppression from other diseases or treatments. The main sign you'd expect is recurrent, persistent infections. Their defenses are down.
Got it. And lastly, back to fibrinogen abnormalities. High fibrinogen, hyperfibrinogenemia.
Caused by inflammation. Simple as that. Any kind. As we said, it's arguably the most sensitive acute phase protein in horses. Levels often jump over 400 milligrams per deciliter within just 24-48 hours of the trigger.
So super useful for detecting and tracking inflammation. You mentioned a ratio too, the PPF ratio.
Yes, the plasma protein to fibrinogen ratio. It can sometimes help distinguish inflammation from dehydration. Generally, a ratio below 15 suggests inflammation is the primary driver of the high fibrinogen, whereas a ratio above, say, 20 or 21 might suggest dehydration is contributing more significantly to the total protein concentration. But you have to use it cautiously. It's not reliable in foals, or if there's a reason fibrinogen might be low.
Okay, so what about low fibrinogen? Hypofibrinogenemia, that sounds serious.
It usually is. The most concerning cause is disseminated intravascular coagulation, or DIC. That's a catastrophic, life-threatening condition.
Gee, I see. What's happening there?
Basically, the clotting system goes into overdrive throughout the body, forming tiny clots everywhere. This consumes all the clotting factors, including fibrinogen, faster than the liver can make them. Then, paradoxically, the horse starts bleeding uncontrollably because there are no factors left.
That sounds terrifying.
It is. DIC is often secondary to severe systemic problems like sepsis or shock. Other causes of low fibrinogen could be severe liver failure, since the liver makes it, or just massive hemorrhage and dilution with fluids. The main sign is usually excessive bleeding or bruising.
This really does sound like complex detective work for the vet. How do they actually measure these proteins and start putting the pieces together?
You're right, it's definitely a puzzle. The basic blood work usually starts with total protein, TP, often done quickly using a refractometer right there in the clinic or field. Albumin, ALB, is measured by automated chemistry analyzers in a lab. Globulins, GLOB, aren't usually measured directly, they're calculated. Total protein minus albumin gives you the globulin level.
Simple calculation.
Yep. And fibrinogen, FIB, can be measured by heat precipitation. It's quicker, less precise, or by the Claus method, which is more accurate and done in a lab. And again, calculating that plasma protein to fibrinogen PPF ratio adds another layer of information.
Okay, so that's the initial screen. But then the further tests depend heavily on what those first results show, right? Pointing towards the likely problem.
Absolutely. It guides the whole investigation. If you have hypoalbuminemia or hyperproteinemia, the vet's thinking, where's this protein going? So next steps might be a urinalysis, looking for protein in the urine with a urine protein. Creatinine ratio that checks for kidney loss, PLN. Liver function tests check the liver's production capacity. A fecal exam looks for parasites causing PLE. Abdominal ultrasound or rectal exam can evaluate the gut for thickening or masses. Maybe specialized tests like glucose absorption or even intestinal biopsies if PLE is strongly suspected. Sometimes a fecal blood test like the SEC test can help pinpoint hindgut issues. You're basically hunting for the leak or the production failure.
Makes sense. And if it's the opposite, high globulins or fibrinogen hyperglobulinemia or hyperfibrinogenemia,
then the hunt is on for the source of inflammation or infection. This means a really thorough physical exam looking for hidden issues like hoof abscesses, pneumonia, internal abscesses, uterine infections, anything. Imaging like ultrasound or x-rays can be crucial. Taking samples for culture and sensitivity testing helps identify infections and choose antibiotics, and importantly, serum protein electrophoresis, SB.
The SPEP test you mentioned, to map out the globulins.
Exactly. It gives you a graph showing the different globulin fractions. A broad, general increase across multiple fractions of polyclonal gammopathy strongly suggests a widespread inflammatory or immune response. But if you see a single sharp spike in one fraction of monoclonal gammopathy that raises a red flag for certain cancers like multiple myeloma, it really helps differentiate.
Okay. And for low fibrinogen, hypofibrinogenemia, especially if DIC is suspected.
Then you need a full coagulation panel. This includes tests like prothrombin time, PT, activated partial thromboplastin time, APTT, platelet count, and often D-dimers or fibrin degradation products. These tests assess the entire clotting system to confirm if DIC is happening.
And for those foals with suspected low globulins.
For hypoglobulinemia in foals, the key is a rapid serum IgG test. There are stall-side SNAP tests that give a quick result, confirming failure of passive transfer, FPT, so treatment can start immediately.
Right, getting that diagnosis quickly is vital for them. So once the detective work leads to a diagnosis, what's the general approach to treatment?
Well, the absolute core principle, the thing we always emphasize, is that treatment is always directed at the underlying cause of the plasma protein change. You have to fix the root problem. You can't just say, give albumin without fixing why it's low.
Right, treat the disease, not just the number. So for hypoalbuminemia or hypoproteinemia, that means things like deworming for parasites, antibiotics for infection, maybe corticosteroids for inflammatory bowel disease, or even surgery if it's blood loss.
Precisely. Address the primary issue first.
But what about severe cases, especially with that edema we talked about?
In severe cases, yes, plasma transfusion can be literally life-saving. Giving intravenous plasma provides albumin, globulins, clotting factors, everything the horse is lacking. But we're often talking large volumes, 4 to 10 liters, sometimes even more for an adult horse, which can be costly and intensive. Good nutritional support and careful fluid management are also really crucial supporting therapies.
Okay, and for the high protein situations, hyperglobulinemia or hyperfibrinogenemia.
There, the absolute priority is to find and eliminate or control that source of inflammation or infection, whatever it is. Antibiotics, draining an abscess, anti-inflammatory medications. You have to shut down the stimulus. And then monitoring those protein levels, particularly fibrinogen, helps tell you if your treatment is actually working. You want to see those numbers coming back down towards normal.
And for the scary low fibrinogen scenario, hypofibrinogenemia, like with DIC.
That requires really aggressive management of whatever triggered the DIC, usually severe sepsis, shock, or maybe endotoxemia. Intensive care is often needed. And again, plasma transfusion is vital here, not just for albumin, but critically, to replenish those consumed clotting factors and try to stop the bleeding.
It sounds incredibly complex to manage.
It can be. And just to circle back, a quick word on prevention, especially thinking about those foals in FPT. Ensuring that newborn foal gets good quality colostrum and enough of it within those first few hours of life is absolutely vital. Prevention is key.
So what does all this really mean for the horse? And for you listening, maybe as an owner or caregiver? The outcome, the prognosis, obviously varies a lot depending on the underlying disease.
Hugely. But it often improves significantly if that primary cause can be successfully identified and treated. Fixing the root problem allows the protein levels to normalize. What's just so fascinating, I think, is how this seemingly simple blood test, looking at plasma proteins, gives us this incredible window into the horse's internal world. It really does. It reveals these complex physiological processes, points us towards hidden problems. It makes the invisible visible in a way.
Exactly. It's that aha moment, isn't it? When you realize how understanding these specific markers, albumin, globulins, fibrinogen, really empowers a much deeper understanding of equine health and helps make sense of what the vets are doing. And it makes you think, if a few drops of blood can tell such a complex story about a horse's health, what about the intricate narratives hidden within our own bodies? Or in other animals? All these stories is waiting for us to learn the language, to learn how to read them. It definitely sparks curiosity. What stands out most to you from today's deep dive?